My name is Dana Goldman, and I want to welcome you to our webinar. I'm exceedingly pleased to be able to introduce our next two guests who have been great friends of the Schaeffer Center. And our first guest is Professor Ann Case, who's a professor emerita at Princeton University, where she continues to teach at the School of Public and International Affairs, which you'll notice has a slightly shorter name. And our second guest is Professor Angus Deaton, who's a professor emeritus at Princeton and is also a presidential professor at USC. And the topic today is going to be their book, Deaths of Despair and the Future of Capitalism, which was published in March. And I wanted to, before we begin, they'll tell you about the book and then we'll engage in a Q&A. And just as a reminder, this is being recorded. But I did want to say that one thing that is amazing about this book and all of their writings, quite frankly, is both its accessibility and its thoroughness. And I urge you, and by the end, we'll get into it. They take 2 decades of research that they've been doing on this topic and synthesize it and take it exactly into broad brush views of the trends that are going on in the United States. And it's an example of what economists should be doing, in my view, but often don't do. So I'm going to turn it over to them now, and they'll present for about 20 minutes. Thank you, Professor.
Thanks so much, Dana. It's such a pleasure to be with you. We really appreciate the invitation. So we're going to start by talking about our book, and then we're going to talk about relationship between the themes that we've written about and what's currently on everyone's mind with COVID. As Dana said, we have a new book that grew out of a series of papers that we've written, and we just want to acknowledge funding from the NIH, which has supported that work. And just to start, even before the arrival of COVID-19, the lives of Americans without a bachelor's degree, which is about 2/3 of the population between the ages of 25 and 64, their lives were coming apart. And in the book, we document what that means in terms of despair and excess mortality. And then we try to dig in and talk about what we think are the long-run forces behind that. So the work that started when we realized that unlike the other wealthy countries of the world, in the US, among white non-Hispanics, mortality rates in middle age stopped falling in the late 1990s and actually started to rise. So the rest of these countries were seeing 2% declines per year in their mortality rates, and ours turned the wrong way, just entirely left the herd. Hispanics, who have lower mortality than whites, look a lot like the Brits, and African Americans, who have higher mortality than whites, have continued to have higher mortality than whites, but their mortality rates were falling nicely. So there was something about what was happening with whites that we decided we would go and dig into. And what we found was that one of the things that had not been being discussed was that after decades of real progress against heart disease, for reasons that are not entirely yet fully understood, we just stopped making progress against heart disease. So one of these engines of mortality decline just shut off. And in addition to that, we found that deaths from 3 causes, drug overdose, suicide, and alcoholic liver disease, were rising, had been rising from the early 1990s. And here what we've drawn are mortality rates for one particular age group. This is for whites age 50 to 54. And we divided them between those with and without a college degree. And you can see that almost all of the action is happening among people without a BA. And in the mortality work in the book, and also talking about morbidity and talking about social dysfunction, we find that that BA, non-BA split is quite meaningful. It's useful for us because education since 1989 has started to be recorded on death records, but it's also useful because the fraction of Americans with a BA has changed very little over this period of time from the early 1990s through the mid-teens, so that we don't have to worry quite as much that this group is becoming more and more select or negatively selected in some way. Now, this is just people aged 50 to 54, but we find what's happened to them is happening in all 5-year age groups between the ages of 25 and 29 in the upper left-hand corner there, middle age 60 to 64 in the middle right, and then it's also beginning to bleed into what's happening to the newly elderly ages 65 to 69 in the bottom there. So what started as work on what's happening to people in middle age, we realized whatever this is that's happening, it's happening actually throughout midlife, which is a bit more disturbing. It's not as if this is just the baby boomers, they'll exit stage right, thank you very much, and then suddenly everything's going to be okay again. It's happening also among the younger adults. And the numbers are big. In 2018, there were 158,000 deaths in the US from drugs, alcohol, and suicide. And that's up almost 100,000 deaths from 1995. So sadly, we will reach a number like that or higher with COVID deaths. But the difference being that COVID, hopefully there will be treatments or there will be a vaccine. But this other epidemic, which started slowly and has been picking up speed and more speed and more speed. We have no reason to think that that's going to disappear. It's invisible, most because it's happening to people without a bachelor's degree, but it's a really serious issue here. So that we started to dig, and it took us all the way back to Durkheim, because while drug overdose and dying from alcohol are not suicide, they have something in common with suicide. It's all deaths by one's own hand, and it comes about to people who are in despair. And Durkheim wrote about the fact that he expected more suicides in times of great upheaval, good or bad. And we think that's what's happened to people, whites in the US currently without a BA. And what do we know about these people? Well, it's men and women. So headline writers like to talk about white men dying, and indeed they are, but men and women without a BA, the trend lines have been almost identical. So it's whatever it is, whatever the phenomenon is that's at work is hitting both groups about equally strongly. The increases have been almost identical. Oh, and I wanted to remind myself to ask you if you can find the Great Recession in this picture. Because what we see is that this trend of increases in these deaths of despair started before the Great Recession. They moved smoothly upwards through the Great Recession and after the Great Recession. So we don't think it's about concurrent economic conditions. We think it has deeper roots, older roots. And underneath that mortality count, we find that pain has increased dramatically for people without a BA, not for people with a BA. Also, in the National Health Interview Survey, through a battery of questions, you can get a sense of someone's mental health. And we find people at risk of poor mental health has been increasing among those without a bachelor's degree year on year on year. Now, with mental health or with pain, those are self-reports, and it's much easier to dismiss those. But when you combine those with what's been happening to mortality rates, they all fit into a bigger picture. And what do we think is behind this? Well, we think we have to go back to a long-term labor market decline for people without a bachelor's degree that started in the early 1970s. And we don't necessarily think it's about the loss of material goods and material well-being, but that loss brought with it loss of community, loss of marriage. People without a BA feel like they can't get married unless one of them has a job with prospects. and those jobs are much harder to come by. Loss of meaning in work, loss of status, and also a loss of feeling like they're part of a working democracy. The political representation that they see themselves having in DC has been eroded as well. And there's no sort of big movement of labor that is countervailing to the movement of capital when it comes to making decisions in DC. So just to give you a sense of this long-term labor market decline, this is median wages. So this is the 50% mark for men aged 25 to 54 from the late 1970s through to 2019. And there was much celebration that in the last couple of years, wages have been rising for people without a bachelor's degree. Yes, they've been rising, but they're nowhere near where they had been in 2000, and that was nowhere near where they had been in the 1980s. And along with that decline in labor and with wages, there's been a lack of attachment to the labor market. So the employment to population ratio among these men, all men here, 25 to 54, has been falling. It goes up and down with the business cycle, but every time it comes back up, it never reaches the level that it had been at before. So there are fewer and fewer and fewer men who are engaged in the labor market over the long run. Now we know that wages change very little if you stay in the same job. So the loss of wages comes about because you lose a job and then you find another job. And a lot of the jobs, the new jobs, are outsourced jobs. They're jobs with transport companies or security or food services that don't belong like to a big hotel chain. You belong to the Albright cleaning company. You no longer belong to Marriott hotels. There's less commitment on either the employer or the employee side. Those jobs have less meaning, and it's harder sort of to see yourself as part of a good life. And we think that the loss of status and meaning in jobs has a lot to do with people then also losing the ability to get married. So your work life is fragile, your home life is fragile. People cohabit, they have children on wedlock, then they break up. The father may not see the children anymore. The woman's living with a new man. He may have a new partner. And there's just not the kind of stability. It's great upheaval of the kind that Durkheim talked about. Now, globalization and automation have hit all the countries, rich countries. So what makes the US different? Why has this happened to us? So the two things that we thought of that make things different for the US, one that's gotten a lot of attention is the opioid crisis. And we can come back to that during the Q&A, but what we see is that this started before OxyContin was on the market, but the opioids landed on ground that was fertile for abuse. And the pharma companies actually targeted people's despair. What else is different about the US? Well, the US has the most expensive healthcare in the world. But on a lot of metrics, we have the worst health in the rich world. Life expectancy, we argue, fell in the US for 3 years running, not in spite of what we spend on healthcare, but because of what we spend on healthcare. And if you look at us relative to our comparison countries, you get a sense about just how far from the herd we've come. So if you look at life expectancy at birth against expenditure on health expenditure per capita in the UK from 1970 to 2015, you see both are rising. And in Australia, both rising as well, but they're in the same neighborhood. Canada, a little more expensive, but same progress on life expectancy. France looks a lot like these countries as well. Switzerland, which is the next most expensive country, except the US, higher life expectancy, but also a lot more expensive than its neighbors. In the US, our healthcare from 1970 to 82 cost us this much, life expectancy going up. Here's 82 to 90. And then here's how much we spend per person on healthcare in 2015, and our life expectancy had begun to fall. So one of these countries is not like the others. We spend 18% of GDP on healthcare. Switzerland spends 12%. That the difference in terms of percentage of GDP is more than $1 trillion a year. It's more than $8,300 a household, which could go a long way to helping people keep body and soul together. And that's just the excess spending. That's not the total spending. That's just over and above what the next most expensive country in the world actually pays for healthcare. And it's half again as much as all of our spending on the military. And that spending has to come out of somewhere. It comes out of wages, it comes out of profits, it comes out of taxes. So a lot of people think that the healthcare they get from their employer, the insurance they get is a gift, but it's not a gift. It's going to be deducted from what the employer would have been willing to pay for this worker. And they won't pay it in wages if they have to pay the healthcare premium. So, and a lot of the firms who face what is now a $21,000 a year premium for a family of four is going to say, my low-wage worker isn't worth that to me. I'm going to outsource, get McKinsey in here, I want to outsource those jobs. And it's interesting because the premium you pay doesn't really depend on how much the person earns. It's like a lump sum, it's a poll tax. There's been a lot written on what the minimum wage does to whether or not it takes jobs away from low-wage workers, but very little has been written on what this kind of a wedge does to the low-wage labor economy. We argue that it's like taking a wrecking ball to the low-skilled labor market. But right before I turn it over to Angus, it's also the case that state and local governments who have to pay their share of Medicaid have very little left over for public universities, for infrastructure, for the things that help to keep everything running and running well, and giving poor students a leg up by having them go to a once great state university where now the tuitions are sky high. And then came COVID.
And here I'm going to be the bad guy and talk about COVID. This is the employment population ratio graph that Anne showed you updated, though this covers all men and not just ones with less than BA. And the point to notice here is that this up and down thing that you saw before, going down in the business cycles and then picking up again, of course, we now got this abrupt drop as a result of COVID. If you look at labor markets, you can once again see that the people with high school and no college, the unemployment rate went up from 4.4 to 17.3, a bit back to 15.3 in May. And there's some for the people with a BA or more, but it's, again, much less severe. And once again, you can see the population, employment to population ratio. So the COVID is exacerbating the thing that Anne talked about before. Social distancing further widens the gap between those with and without a BA. Again, it's not a perfect match. And African Americans who've done pretty well up until 2013 in the deaths of despair story are not doing well in COVID. So it's not the same match. But without a BA, you're either essential or non-essential. Many people have written about this now. The essential workers risk their lives. The latter risk their livelihoods. The non-essential people in non-food retail, services, restaurants, etc. When it opens up, as we're going to see at the end of this month, people risk losing their unemployment benefits if they choose not to work. Meanwhile, people like us, the educated elite, stay at home, peer into our computers, appear on Zoom, go on working, stay safe, and get paid. Now, so this lower education group is going to lose out on life expectancy, it's going to lose out on income, and so the mortality differential across these groups is surely going to widen, and so will the earnings premium, which currently is at the astonishing level of 80% premium for people with a BA or better compared with people with no more than a high school degree. Of course, we're not really talking about it here, but in poor countries, this dilemma is much worse because the social distancing doesn't work very well. Do want to emphasize, though, the inequities are not identical from pre-COVID. African Americans were exempt from deaths of despair prior to 2013, at which point fentanyl hit the streets in the East, and not so with COVID. Some educated people are on the front lines, especially in healthcare. There are also many Hispanics in healthcare, and if you remember, almost the first graph Anne showed you was one in which Hispanics were doing like Brits. And I think it's going to be controversial what happens in the end, and it's changing as the geography of the pandemic change. But otherwise, the patterns of despair will be exaggerated by the pandemic. Now, what about the healthcare system? Well, we don't know for sure, but perhaps 27 million people lost health insurance as a result of losing their jobs in COVID. It's something that people in Britain or France and so on, when they lose their jobs because of COVID, they still have health insurance because it doesn't depend on employment. Many of those people could replace it through COBRA, which costs a lot of money. You have to pay your own and the employer's contribution, or through Obamacare. So this was not a good time to have employer-based healthcare. The CARES Act is covering some charges for now, and private insurers may forgo deductibles, etc., but there's no protection from surprise medical bills. And there seems to be a great variation in payments, even for tests. Most people seem to get tests for free, but other people get charged large sums of money. And there's an enormous number of people who are being hospitalized who would not have otherwise have been hospitalized. I mean, as of July the 1st, 250,000 people have been hospitalized for COVID, in addition to the 130,000 who have died, and most of those died in hospital. That 250,000 includes 15 states plus DC that for some reason do not report hospitalizations. And those 15 states include high death states like California, Illinois, Louisiana, Michigan, Pennsylvania, and Texas, which are more than a third of all deaths. So if you scale it up, you're probably talking about 350,000 people plus, so 500,000 people who've been hospitalized. So if we're halfway through the epidemic, perhaps 1 million people will have spent time in hospital before the end. On a normal pre-COVID day, about 600,000 people are in hospitals. But of course, if we're halfway through, we might not be anywhere like halfway through. So if herd immunity, which may not even work, herd immunity could require 200 million infections. So far, only 3 million confirmed. If it's a 10-to-1 ratio, there may be 30 million infections out there. 1 million, so we might need 1 million more deaths in order to acquire herd immunity. Remember, we've had 130,000 so far, so we're only about 12 or 15% of the way there. That could include 3 million total hospitalizations, including deaths and recovery. Who knows how this is going to be paid for? And who knows whether the Congress will keep paying for it, or whether hospitals will go back to their previous billing practices and simply try to get money out of those people. It's very hard. I don't know, for those of you who've been watching soccer in the English Premier League, one of the first sports to come back, much to my joy, they're all wearing badges on their shirts thanking the National Health Service of Britain. And I find it hard to imagine NFL players this fall all wearing badges that thank the American healthcare system. Of course, it might work out that in the end, the healthcare system is seen as the hero of the piece. I think it's more likely that it will be seen as the villains of this piece, especially if hundreds of thousands of people finish up with bills, whether the deductibles or whether they were uninsured, that they won't be able to pay. That might actually get us in a situation where we have a real potential for reform. And you know, what has always prevented that in the past is the incredible power of the healthcare lobby, but lobbying tends to be powerless in the face of a hugely salient issue in the public, the same if there's mass public anger. The same, I think, is true of pharma. Pharma really has a chance to redeem itself. But if it doesn't come up with a vaccine, or it comes up with a vaccine and meds that are charged enormous sums for, then it could have used up its last chance. So that's all we have to say. And I'm going to shut this off and hand it back to Dana.
Thank you for that excellent presentation. I just want to say that I could see the NFL players wearing a logo that says United Health, although it would be for a different reason, I might add.
Right.
I just want to remind people
and
that
those British soccer players are not being sponsored by the National Health
That's right. That's right. We should clarify that. It's solidarity, not marketing. So I just want to remind people you can submit your questions through Q&A, but and also for those who arrived late, we're talking with Professors Case and Deaton about their book, Deaths of Despair and the Future of Capitalism. And I have a few questions for you, if you don't mind. And especially I want to focus on part 4 of the book, where you really ask, why is capitalism failing so many? And you've talked a little bit about that here. And one of the things you do is you draw a very provocative analogy between what the US is spending on healthcare and the reparations that Germany was forced to pay after the First World War. And as you know, the great economist John Maynard Keynes predicted that these would be a disaster. And you do acknowledge we're getting something for our spending, but clearly not enough. So my question to you is, Germany fell into fascism and World War II partially as a result of those reparations. Where do you see us going?
Well, we certainly are not looking for fascism. And you know, one of the things that if systems change under revolutionary pressure, which is what you might be talking about here, if they break as opposed to get reformed, there's always great danger. Right. And other people have made the analogy to us that you just made. And they said, well, you know, after the 1930s, in the US, things looked like they were broken, and we got Roosevelt. Germany got something different. Right? Or put it another way, it's not always a phoenix that rises up out of the ashes. Really horrible things can rise up out of the ashes. So I think it's something of a crux point here that, you know, the pharma might come up with a vaccine. It might make it widely available to the whole world in a way that covers it with glory. The healthcare system, though it's not clear how it's going to pay for itself, how it's going to pay for the cost of running this epidemic. And there's been a lot of destruction and reorganization and hospitals being forced to merge, at least pro tem. Andrew Cuomo essentially socialized the health hospitals in New York City.
New York State.
New York State. So, you know, there's certainly, we're not going to come out of this like we were before. And, you know, we would, of course, like to see a situation in which we join other rich countries. And, you know, there are lots of ways of getting there. I know you have a very elegant plan. You know, Vic Fuchs has a plan with, what's his name, with Zeke Emanuel. There's Medicare for all, there's Medicare for America. And we've got all the systems from other European countries, all of which might work here. So, you know, we're very careful in the book not to argue for a particular plan, simply because we think you just need to get it done somehow. But we need to get away from this monster that's eating the economy alive, that's generating most of the federal deficits, at least before COVID, that's stopping people getting educated, that's destroying jobs in the labor market and delivering really bad health.
What we really need is for people in the middle of the distribution to start talking about this, right? It can't be just a lefty issue. And so I think that this may offer that unfortunate chance that there are going to be a lot of people in the middle of the distribution who suddenly, they know it's confusing, they all know it was expensive, but they sort of shrugged and went away. Now it might be incredibly salient, and you need those people in the middle to want change.
Right.
And so I think hopefully that's the Pollyanna in me saying maybe there's that silver lining.
Sure. And I want to follow up on that because you talk a lot, or you talk some about monopoly power and the role that unions play in counteracting that. And we know monopoly power exists in the healthcare sector. But I also want to, again, provide a historical analogy. In the 1950s, AT&T employed about 1 million people, which was almost 2% of the entire civilian workforce. And AT&T had a monopoly in some ways, and it had a union, and they were able to negotiate pretty good benefits for everyone as a result of these interactions between labor and AT&T. Now you look today, and Walmart is now the largest employer, and it's more than double AT&T at its height, but it operates in an incredibly competitive market. And so who is going to protect the workers now, and what do we do there?
I think that's one of the big issues of the day. And, you know, we can argue, and a number of people have been arguing, and we do argue in the book, that we welcome some sort of revival of the unions. I mean, you know, someone like me that grew up in Britain, I thought I'd never say I wanted to see the revival of the union, because at their worst, they were really terrible. But it's clear that there has to be some sort of new social contract which includes working Americans. Otherwise, you get what we've got now, which is this enormous division. These people, you know, in the old days, the Democratic Party used to represent working Americans. And now it's become a coalition of minorities and the educated elite. And then the working people of America have been sort of left behind. And, you know, they voted for Donald Trump in large numbers.
But the other part is, though, that it's sort of an historical accident that firms became the social insurance providers in America, right? Pensions, healthcare. They don't want to be in that business. Now that they are in global competition, they can't afford to be in that business. So defined benefits became defined contribution pensions. They would love to get this off their plates as well. So I would hope that there might also be a push from corporate America toward let's find a way to provide these benefits. They shouldn't be tied to employment, although I know some of my friends on the right like them to be tied to employment because they think people need incentives to work, and they just all sit at home if it wasn't for the fact that they needed their health insurance.
Some of it, of course, takes us back to the original sin in American policy, which is race. And, European countries got welfare states. And at the same time in America, there was a lot of interest in doing that. And it couldn't happen because of the power of Southern Democrats and people who didn't want to extend universal benefits to Black people. And, we're reaping the legacy of that to some extent now. Because, the Blacks went through this horrible period in the 60s and 70s. They were the sort of first wave of being hit by globalization and global competition. And they, had a spate of social destruction, not unlike what we're describing for whites now, which also ended in a drug epidemic. The whites escaped that for a while, but now they're getting it. Less educated whites are getting the same sort of thing over again. And, we need better social protection of some sort.
Yeah, and I want to come back to that issue of race, but just following up on something, Ann, you said, for those people who studied economics in the audience, it's the whole point is initial conditions matter a lot. And we're a victim of some wage and price controls that were instituted in the 1940s, and they've in some ways set us back on policy. One of the interesting things for a long time was corporate America wasn't really interested in these benefits because they just weren't big enough to actually affect the bottom line. But obviously, as you've pointed out, they are big enough now. And so I tell my health policy colleagues, you don't need to talk to government. You need to be talking to corporate America if you want to try and change. But I want to ask you, one of the interesting things in the book is that you highlight some of the differences between Black progress and white progress. For example, you note that in Americans' acceptance of interracial marriage, you quoted pollster Frank Newport, who said, one of the largest shifts in public opinion in Gallup history. Given what has transpired recently, have your views on these issues changed, or?
I think, I don't think so. I mean, you know, we don't claim there isn't a long way to go.
Yeah.
And, you know, so progress and growth is different from levels. And I think what we're seeing now is, to some extent, a level effect. You know, that this inequality that's been there forever has become sort of intolerable. And it actually might have been, you know, the revolts that we're seeing may actually be an indication that so many blacks are doing well enough to support this, you know, this thing that's coming up from below. It's also the thing that's new about it that really is extraordinary, and it maps in with that, you know, with what you said about the support for marriage, mixed marriage, is how many whites are supporting the Black Lives Matter and so on. And that's, of course, not all whites are supporting that, but it used to be like none of them, and now an enormous percentage of them are in favor of these movements. So I think there really has been real progress. And you could interpret what's happened over the last few months as, to some extent, a sign of progress. You have to be pretty optimistic like I am, but I think one can make that determination.
The distinction between BA, not BA is really large in the African American community as well. So the group with the lowest deaths of despair are blacks with a BA. If you look at life evaluation, if you look at people's expectations for the future, the splits there are by education, not by race. So it looks like if we could somehow get people to merge forces and think about this as a low-skilled problem that both groups face, I think that there would be a lot of power in that.
Thank you. So we've got a bunch of questions, some of which you've answered, but one that follows up on that is, if the returns to going to and completing college are so high, what prevents whites and blacks from doing it?
It's a really good question, and we ask all of the people we know who study education that. And it's some combination of the fact that it's very expensive to go to a state university, in a way in the past it would have been an easy way, a put your toe in the water kind of way at low cost, but these state universities now cost almost as much as it costs to go to a private school, a good private school. It's also the case that just education is failing us, period, right? So K through 12 education in places where nobody's minding the store is not giving students what they need to succeed. A lot more students are starting a four-year degree, but not finishing. So then they not only don't have the degree, they have a pile of debt on top of that as well.
And it may be the cost that's restraining them. But, you know, what state governments have to pay for Medicaid, over which they have no control at all. They don't have any control over the prices of Medicaid. They have to take it out of the universities or something. I mean, at one point we talked to a senator in Montana who was responsible,
A state senator
in Montana, who was responsible for the budgeting within the state. And, you know, we were in Missoula, which is like the Santa Monica of Montana. You know, it's where all the leftists live and there are beggars on the streets and so. And I said, is it because, you know, most Montanans just don't like the pointy-headed academics here in Missoula? And he said, that's not true at all. You know, he was a Republican. He said, what it is we have all these calls on things we have to pay for and have no choice over that. And when you can't take the money out of the prisons, you can't take the money out of Medicaid because you have no choice. But if you take the money out of the state system, then they can raise their fees and get it from somewhere else. But, you know, everybody's paying a price for that. And it's sort of eating us alive. One thing I read last year was Elizabeth Warren's autobiography. And it's very interesting how, she was like a waitress and could get course credits in the evening for almost no money. And then she could get into law school in New Jersey for almost no money. And so I think it'd be much harder for people in that position now to get into this educated elite because a lot of the pathways are closed. I mean, that's what Bob Putnam's book, Our Kids, is about, is, he came from a pretty poor background in Ohio and, came up through the educational system like a lot of us did. And he doesn't really think that's there anymore.
So clearly on the supply side, if we can create opportunities for upward mobility, people will take advantage of it.
I think so, but what Anne says about the schools is very important.
It's also the case, though, that one of our prescriptions is not that everyone should have a BA, right? What we think is that people need the kind of training that they could get in some European countries, and that there should be status associated with having certain skills and certain kinds of certificates. And you should be able to lead a middle-class life with those kind of skills. Mm-hmm. So we're not kind of like out there trying to sign everybody up for a 4-year degree, but we want to be able to spread the wealth to people without.
So following up on that, we have one question about deregulation, which is we often, especially in Republican administrations, we hear about the benefits of deregulation. Have these benefits been netted out by the disruption to the labor market, social cohesion, and the like?
But regulation where? I mean, we don't think...
I think this question is broader than just healthcare.
Yeah, but it's important, because I know there's one avenue of Republican thought that thinks if we can make healthcare more like real markets, right, all this problem will go away. And I think Ken Arrow showed definitively about 60 years ago that you just can't do that. And the attempt to pretend you're doing it produces all this rent seeking and this corruption of capitalism that we're actually seeing. I don't know more broadly about the regulation in other industries. I'm sure some of the deregulation is good and the people really like it, but some of it is also just a giveaway. And and the Trump tax cuts, according to Financial Times, Apple got $59 billion. And that was because of a removal of regulation that there was a tax on repatriating profits. Well, you can see why they like that. I'm not sure many of the rest of us benefited from that, but I'm not an expert on those in detail.
So the another question writes about the GI Bill after 1945, which essentially helped white soldiers buy homes. The bill was written, the questionnaire points out, in a way to exclude most black soldiers, but perhaps that is a mechanism for social mobility?
I think it would be great. I think it was a mechanism for social mobility. It was very unpopular in Congress at the time and almost didn't pass. But it really changed not just the fortunes of the people who went to college, but it changed places like Harvard and Princeton for the better too, because, Harvard was on record for a long time as saying it's a terrible idea to have these people come because they'll just not be able to learn. And that turned out not to be true. But I just want to go back to what Anne said. Our high schools, our K through 12 is only sending a third of the people to college, but it's dedicated to getting people into college. Well, either it's doing the wrong thing or it has to change its aims. And, they've got to be better, not better, but different. It can't be that all of our education system is defined from kindergarten to trying to go to college. And there's got to be a lot of other occupations and paths of learning which generate valorized jobs in society and help break down this division we have in America between those with and without a BA, which is not nearly so strong in other countries.
So I think we are at the end of our time. We've been very good about ending on time. I'm going to give you, if there's any last word you'd like to give to our audience, I'm going to give you that opportunity.
Well, just to thank you. Yes. And also that, one of the sadnesses, not the least sadness of this pandemic is I would be spending time there at Schaeffer, and I'm not because I can't get on an airplane. So anyway, thank you very much, and thank you for the substitute.
Well, we appreciate that, but we really want Anne to spend time at Schaeffer, and that's been a little harder to work out. But
we will work on it. I
want to thank you both for your time and congratulate you on a wonderful book, and thank the audience. And I'm sorry if we couldn't get to all the questions. Take care, everyone.
Thanks so much.
Be safe. Thank you.
Bye-bye.
Likewise.